Greetings everyone, my name is Gerald and welcome. Today we are going to look at slight stories behind the stigma, exploring health, discrimination and resilience. And this mainly concerning HIV and AIDS amongst the sex workers. HIV remains a global public concern, and so mainly the main affected people are the sex workers, and because of the nature of their job, you realize that they face a lot of stigma, which is a very negative social label that discredit their social life. Sex workers so face a number of challenges. These are moral judgment, criminalization, HIV-related stigma. And so you realize that they are discriminated against treatment in health facilities, HIV testing, treatment, and so also they fear being arrested and exposure that can lead to avoidance of health services. These are the impacts and outcomes of the challenges that they go through, and you realize that HIV is most rampant amongst the sex workers, and very significant than the general population. And so there's a lot of stigma that they face, which contributes to late diagnosis and poor adherence to antiretroviral therapy, increased mental health and challenges, and also facing depression and anxiety, structural exclusion from health insurance, and denial of services. Health education can actually come into their aid, and this is how it can help them. Number one, through community campaigns, and so public campaigns can actually help normalize HIV testing and treatment, which can also reduce fear and misinformation. This is an example of Terence Higgins' campaign, which emphasizes that stigma is more harmful than HIV itself. Health education, number two, we can use peer-led programs, which can empower the sex workers to share their accurate information about their health, also build trusts, and which can reduce fear and discrimination. Also, peer educators who can act as their role models, which can increase uptake of prevention and treatment. And the third is through media and storytelling, by encouraging them to use their personal stories and to normalize those who can come out boldly and tell their stories. There is an example of Madeline Brown's testimony, which has helped many come out in resilience and advocate for against stigma. And so it can really help, and also just giving them up an opportunity to tell their story concerning their status. And what roles can future health professionals also play to help them? The future health workers can actually provide non-judgmental, evidence-based care, also help them advocate for inclusive policies and discrimination, promote human rights protections, and ensure that there are equitable access to healthcare. And so, as I summarize, realize that stigma is even more powerful than HIV itself, and so health education is key amongst the sex workers, and so help them advocate inclusive care, which can also I challenge the biases and amplify marginalized voices and support vulnerable populations. Thank you for listening.